Hi, everyone. Welcome to our Source Partner Panel on Supportive Services. My name is Mindy Levin. I am the founder and director of Source. We're the Community Engagement and Service Learning Center for the Johns Hopkins University Schools of Public Health, Nursing, and Medicine, and I will be helping to moderate our panel discussion today. First, I do want to say that we are live here in Baltimore. We are on stolen ground, so I want to acknowledge and give respect to the Piscataway tribe, who are the indigenous people who are the traditional owners of the lands of the Chesapeake Bay region. We also want to acknowledge the impact of racist systemic oppression, including the practice of redlining, which started here in Baltimore, and the impact that it has on the lives of Black and Brown folks here in Baltimore. So this partner panel is delivered to you live by Source. Our work is to engage our Hopkins Health professional schools and Baltimore communities in mutual beneficial partnerships that promote health and social justice. And all the work that we do is guided by our core values, which include reciprocity, justice, service, and collaboration. We have a fantastic team. A few of our team members are here on the call, so you might have the opportunity to meet Tyler, Kiala, Tony, Vanessa, Ezot, and Glenn throughout the work that you do with Source. And I do want to particularly mention today Tony Bridges, who helped put this event together, Ezot Shahade, and one of our Source program assistants, whose name is Nathan. And the work that we do is really to encourage our health professional schools to collaborate with local nonprofits. And we do all of our work with a network of organizations here in Baltimore City. We partner with over 100 nonprofit organizations throughout Baltimore City. And whether you are here physically in Baltimore or joining us somewhere around the globe, there's still great opportunities for you to connect with, support, and collaborate with our organizations. Usually at the beginning of each academic year, we have a big community involvement fair. Due to COVID-19, we have been putting on this series of partner panels to introduce our students, faculty, and staff to the amazing assets that we have in our community. We partner with over these 100 nonprofit organizations, and we'll be hearing from a few of those organizations that work on supportive services today, which is really exciting. So we do have a few folks that are joining us from the Franciscan Center, Movable Feast, and Project PLASE. I do want to say, for those of you that are live with us right now, don't worry about grabbing all the contact information. We are going to jump into our chat a little form that if you are interested in following up with any of these organizations after you hear from them today, we'll be able to connect you directly. So don't worry about, rigorously taking down that information. We have a mechanism ready to go to connect you to the organizations. And then lastly, before I get us going with our panel today, I always have to shout out the ways that you can stay connected to Source. And we are all over social media. Our handle is always at @JChooseSource, whether that's Facebook, Instagram. We have a YouTube channel, all that kind of good stuff. Lots of ways to connect. I am going to stop sharing my screen here. Fantastic. And what we're going to do first, we are going to hear from the organizations. They each have a small slide deck to tell us a bit more about the work that they do. And then at the end of that, we'll turn it over to ask some questions, learn a little bit more. We have some pre-prepared questions, but for those of you that are joining us as our guests and you're here with us live, here's an opportunity for you to ask those questions. So I am actually first going to turn it over to Angie Kelly. Actually, before I do that, let me say this first. Angie is going to be going first, so Ezra, if you want to get the Movable Feast slides ready to go. But what's really exciting to me is that Source, we also have a governing body that's called our Source Community Council. And our Source Community Council is made up of about 15 representatives from our network of 100 nonprofits. And all of our panelists happen to be on our Source Community Council. So extra shout out. Yay. So Angie Kelly, I'm going to turn it over for you to talk a little bit more about Movable Feast. And Ezot's going to get your slides up, and you can just say next when you're ready to advance. We've got to go there. Thanks for being with us, Angie.
Yeah, of course. I'm so happy that I can be here. I know that this is very, very different than what we would usually be doing. And I certainly miss interacting with all of the Hopkins students in person at this event. So as Mindy said, I'm the volunteer manager at Movable Feast. I've been with the organization for about 5 years as an employee and 2 years as a volunteer. So I know Movable Feast inside and out. So at the end of this, please feel free to ask me any questions at all. Next slide, please. Okay, so Movable Feast, what we do here is we home deliver medically tailored meals to clients that are at the intersection of chronic illness and food insecurity. So all of our food is catered to the dietary needs of our clients depending on what illness they are currently in treatment for. So we serve HIV, cancer, heart disease, diabetes, renal disease, and our meals come at absolutely no cost to the client. And our clients are in positions where they can't afford or don't have access to food for whatever the reason may be. Like, it could be affordability, they may not have transportation, they may live in a food desert, live in isolation, don't really have anybody to support them. Or because of their illness or their treatment, they simply just don't have the energy to grocery shop or make a meal for themselves. And in addition to our meal program, we also offer medical transportation. So we are taking clients to doctor's appointments. We have dietitians on staff that provide nutritional counseling for our clients and really help guide them along in meeting their nutritional goals while they're in treatment for their illness. And then we deliver supplements and grocery bags for clients that may be particularly food insecure. Next slide, please. All right, so we are actually in our 31st year. I did not update that part. We started in 1989 in response to the HIV crisis when, the government wasn't really doing that much, if anything at all, to respond to this crisis. And so there were grassroots organizations that popped up all over the United States. We happened to be one of those organizations in Baltimore, where we had a group of friends who saw that there was an issue that needed to be addressed and that people with HIV were really, really suffering in isolation without any resources at all to turn to. And so they started by making meals out of their own home kitchens and going out to delivering it to people in person. And it was, yes, a way to provide nutritional support, but it was really about providing emotional support and saying, hey, we are not afraid of you and you deserve care and compassion. And those have been the two things that have really driven Movable Feast over the years, is the idea that food is medicine and that no one should be alone. And that's something that's even more important right now while we're dealing with this COVID crisis, is that the feelings of isolation that our clients are experiencing are really intense right now, while the world is quite literally a dangerous place for them because of their compromised immune systems. We serve almost the entire state of Maryland. We currently have approximately 675 clients, but as people cycle on and off of the program throughout the year, it ends up being roughly 4,000 people. Most of our clients are in Baltimore City, but we also deliver to the 5 surrounding counties and the entire Eastern Shore. Next slide, please. So this is just an overview of all of the services that we have. I mentioned the home deliver meals, which is our main program that we have. Clients typically get 12 meals a week and a fresh produce bag. Some clients receive 18 meals a week if they're particularly food insecure. We also offer a family program so that if there is a client who has dependents, if they're struggling to take care of themselves, they're typically struggling to take care of their children as well. And so we can offer a family plan to those clients. We have groceries available. During the holidays, we try to throw in, some turkeys and other extra things to make it a little more festive for our clients. The medical nutritional therapy, that's the program that's provided by our dietitians, which typically we do in-home visits, but we're not able to do that right now. So we just incorporated telehealth for the first time ever this year, which has had some limitations because of what our clients may or may not have access to. So we are looking forward to being able to do in-person visits again one day. In addition to those programs, our drop-in center and community partner meals, those are shelters that we have partnerships that we also prepare and deliver food to. Those are not medically tailored meals. They're typically like box lunches or breakfasts, but they're still catered towards those that are living with HIV. And then our medical transportation, of course, is taking clients to our doctor's appointments. Next slide. Okay, so for volunteering, things are looking a little different right now, again, because of COVID. And so for the kitchen assistant, that is usually our greatest need for volunteers. But because of the number of volunteers that we used to host, it's not a safe number anymore. So we've gone from 150 volunteers a week to 8 volunteers a week, which is quite a big difference. And we're really trying to control how many people are coming in and out of our building. So the kitchen volunteer position is only open to people that have volunteered with us before. So if anybody on this has volunteered with Movable Feast before, you are more than welcome to sign up for kitchen shifts. You should already have an account in Volunteer Hub, but feel free to reach out to me directly about that one. We also used to host groups. We're not doing that right now. Hopefully by springtime, some things will have calmed down and we'll be able to reopen our kitchen program again. But you can participate in some of our other ones. So you can be a delivery driver if you have regular access to a vehicle and a valid driver's license and insurance. You can actually deliver the meals directly to our clients, and everything is completely no contact. You can be an office volunteer. I know that Hopkins is still encouraging people to only do virtual things, right? Right, okay. We do have some of that going on. The biggest one is our kindness cards, and that is a form that is on our website right now. And it's just a way to let our clients know that you're thinking about them. As I mentioned, our clients are experiencing some pretty intense feelings of isolation right now. So you can just write 1 to 3 sentences on this form directly onto our website, and we print them out onto a really pretty note card, and we deliver them with our client meals. And it can just be anything from thinking of you to a silly joke that you heard. But it's really just about letting our clients know that they're not alone. And we do hope to have some other opportunities available. We have had people be able to do client phone calls from home, which is really just calling our clients to do a wellness check to see how everything is going during COVID and if there is anything additional that we can do to support them at this time. Like it comes with a very standard questionnaire with a standard script, and you're just recording the client's answers onto a spreadsheet and giving it back to our dietitians. This does not have a regular time attached to it. It's just something that as it pops up, I reach out to volunteers. So if that's something that you're interested in, you can contact me directly, and I can keep you on the list of people to reach out to when we have a need for people to do things like client phone calls. And we do have a couple of other things like special events, which won't occur until May. So I don't want to get too much into that. In the event that Hopkins is still encouraging folks to only do virtual things. But again, you know, if you want me to reach out to you personally about any of this stuff, let me know, and I'll keep your email address on record. Next slide. Thank you.
Awesome. Angie, thanks so much for sharing. You know, I've been working with Movable Feast for more than 20 years, and it's always great to hear about the great work that you all are doing, not just here in Baltimore, but all over. And you're right. So some of the things that have come up and what we're living through right now with COVID are those regulations that the university is putting out and some guidance. So to clarify that point, just for folks that might be curious, right now, particularly for student groups are unable to organize in-person activities, whether on campus or off campus. And obviously, as you can understand, that there are in-person needs in our communities, not just here in Baltimore, but around the world. And so one of our main resources and ways that people are finding out about community engagement activities for our schools of public health, nursing, and medicine are that individuals to subscribe to what we call our Source Weekly Service Scoop. If you're not already on there, you can send an email to source@jhu.edu. I'll drop it in the chat momentarily and say, subscribe me to the listserv. And we are still announcing those in-person opportunities, but there's always this little note that says, this is not a Hopkins activity. It's not Hopkins sponsored, and it's, you know, do it, but it's at your own risk. We do encourage people, and this is exactly what they're doing. And Angie has mentioned, if there are in-person activities, they are following the protocol of mask wearing, hand washing, social distancing, and all those kind of things. So whatever you're doing in your lives, we have to follow that university policy, which again is also in line with what local government and state government are doing here. So Angie, thank you so much. I'm going to do a quick shift. We are going to hear from Project PLASE next, and Jordan is going to be giving us some more information about the great work that they've been doing, also for a long period of time. And again, another organization that I've been working with for a long time, so it gives me such pleasure to hear from our organizations and to highlight and feature you. You know, we have 100 nonprofit partners, and everybody's like, well, what's your favorite? I'm like, you can't pick your favorite one. They're all of our partners. They're fabulous. But Ezad, if you wouldn't mind getting the slides up so we can give it over to Jordan to tell us more about the great work of Project PLASE. Welcome, Jordan.
Hi, thank you so much, Mindy, for that introduction. Angie, it's funny you mentioned the meals that go to shelters, because a few of our clients actually receive Movable Feast meals, so that's awesome. But Project PLACE is a housing and supportive service organization. It stands for People Lacking Ample Shelter and Employment, and we have been here for over 45 years. So if you could go to the next slide, please. We do provide temporary housing, 3 different permanent housing programs, intensive case management in all of those services, linkages to supportive services, as well as on-site supportive services that are available to both our temporary and permanent housing clients. Next slide, sorry, thank you. So Project PLACE was started in 1974 by 5 undergraduate students at UMBC. Our current executive director, Mary Slaker, is actually one of the 5 original founders. So I always like to mention that because she's really seen a lot of PLACE's different incarnations and how it's grown, which I think is super neat to kind of have that spirit of the organization still here. Originally, when it started, PLACE was a walk-in center. So it was basically a resource that the homeless community had to go to find out the different services available in Baltimore City and the surrounding counties to those experiencing homelessness. And I always like to mention that we were one of the first housing services to provide housing to individuals with HIV and AIDS. So we're super proud of that. Within the last 5 years or so, we kind of went through an extreme time of growth. So we actually gained our supportive services for veteran families program and our celebration housing program, as well as expanded our permanent housing program, which we'll talk about next. Next slide, thank you. So before we get into the individual programs, which are the temporary and permanent housing programs, I do want to mention that all of these include intensive case management. So when our clients initially start with us, they're teamed with a case manager who is able to create their individualized service plan. So essentially what we recognize is that those with the most need deserve the most help. So we serve people with mental illness, physical disabilities, substance use disorder, HIV, AIDS, any kind of, I guess, comorbidity you can think of that would prevent housing stability. And the reason why I mention that is because every single person that comes to us has a different list of things that have kept them from maintaining permanent stable housing and has caused homelessness relapse, as well as all of the issues that are preventing that sustainable housing. So our temporary housing program is consisted of 2 different housing facilities. We have one on 1814 Maryland Avenue, which is definitely closer to Johns Hopkins. And we also have one on 3601 Old Frederick Road, which serves also as our admin offices. And interestingly enough with that, I don't think I'm going to go into it further, so I'll do a quick snippet here. We're in the process of converting our 3601 Old Frederick Road location into affordable housing for 90 homeless individuals. So construction is set to begin in spring 2021, pending, of course, we have a low-income housing tax credit that's still kind of finalizing. But essentially, once complete, that's going to be 56 one-bedroom permanent housing units for formerly homeless veterans and 34 temporary housing beds, as well as a few studio rooms for temporary housing for individuals healing from trauma. So our permanent housing programs are supportive services for veteran families, or SSVF, celebration housing, and permanent subsidized housing. Just really quickly about them, they all do include the intensive case management and like temporary housing, the linkages to supportive services. We actually have MOUs with over 40 organizations across Baltimore City and Baltimore County to help provide those resources that our clients need to reach permanent sustainable housing. So Celebration Housing and SSVF both are veteran focused. Celebration Housing is specifically homeless veterans and their families who are chronically homeless, which means they have been homeless for longer than a year. And permanent subsidized housing, which has a similar format to Celebration in that it is a rental subsidy and they can stay in the program as long as they'd like, is for individuals and their family who has a disability. Next slide, please. Thank you. So real quick, last year we served just under 1,500 total individuals across 929 head of households. Of those, 594 were veterans, 404 were children dependents under the age of 19, and 124 of those head of households were what we consider families. So you can go next, please. Thank you. So we have a lot of different volunteers. Unfortunately, this one specifically, we actually just took off the table with the rise in COVID cases. We decided that the clothing closet we could no longer do safely and make sure that not only our volunteers are safe, but also the clients and the community members that participate. But we will be preparing for when we open again, because we are looking for like a clothing closet manager and a few clothing closet workers to help out with sorting or donations, clothing closet maintenance, speaking and helping with customers, restocking and things like that. So if that's something you'd be interested in once we're able to reopen, we're not going to consider reopening probably until after the holidays, but definitely be sure to reach out, and as soon as we're able to kind of get that started again, we'll have all your information. Thank you. So administrative volunteer, this is the one that I feel like every organization needs a lot of, but it's not glamorous. The reason why we need administrative volunteers is while we have around 60 staff members, a lot of them work odd hours. We have overnight counselors. Both of our facilities are staffed 24/7. We have 2 individuals in our permanent housing program, staff members who are responsible for finding homes for our over 120 families that are in that program. So the administrative volunteer helps with things like data entry, working with our client and constituent management system. They work with audit preparations, making sure that all of the programs have all their ducks in a row, as well as working with our staff members to find homes for those individuals that are qualified for our permanent housing programs. What I like to tell people specifically with this one is if you have an interest or a skill, I guarantee we can find something that would fit your potential skill set and interest. So definitely work out even if it's not listed on the slide. Next, please. Thank you. So moving crew. I'm sorry, I'll do monthly food drop first. Thank you. So moving crew, it's something that is kind of on and off. It's more of a, we'll call you in advance when we have the need. Essentially, we have, even through COVID, have clients moving in to permanent housing from temporary housing or from the streets. So essentially, they don't usually have any furniture or household items or kitchenware or anything like that. Luckily, we're able to collect donations, both the furniture items, household items, linens, things like that, that we're able to give our clients. But as you can assume, a lot of our clients don't have access to transportation of these items. So our moving crew is a group of people that are either just comfortable lifting furniture or have a truck and are able to transport furniture. So if we have a client that's moving into an apartment, we can reach out to everyone about a week before the actual move-in date, so we can schedule kind of like a moving team to help them get situated in their new place. Next, please. Thank you. So monthly food drop, we did, today is actually our last one for the season. We'll resume again in March. We have a lot of older volunteers that help with this specific opportunity. So during the cold winter months, we typically don't do as much, but we do have our food pantry, which we'll talk in a little bit. Just quickly about the monthly food drop, in case you are interested when we resume in March. It's basically setting up tables, bagging produce, taking pictures, distributing food, and breaking down. We serve around 100 individuals for these. COVID has definitely decreased the amount of people that are comfortable coming out, but regardless, we distribute over 10,000 pounds of food, fresh produce, and perishable items on these food drop days. Next, please. Thank you. So Miscellaneous, we do have a food pantry that's open on Tuesdays that's continuing through COVID. We also have miscellaneous volunteer opportunities that are like one-time opportunities like community giveaway events, wrapping presents for the holidays, as well as we have an upcoming blanket ball fundraiser, which will be happening in October 2021, but that will be here before we know it. So we're definitely going to be planning that throughout the next few months. So if you could go to the next slide, please. Thank you. If you have any questions, please reach out to me. I also put our volunteer coordinator, CJ, he was offsite on a training today, so he wasn't able to help with the presentation, but he's phenomenal, and you can reach out to either one of us with questions or complete a volunteer interest form. Of course, everyone also put the, Mindy and Izat put the volunteer sign up in the chat. So just let us know if you have any questions, if you'd like to get involved. Thank you so much.
Awesome. Thank you so much, Jordan, for presenting. So we have a third organization, and unfortunately their representative had an issue arise and isn't able to join, but I have their slides and I know them pretty well. So bear with me. I'm going to run through some of their slides just to give you a little bit of an introduction to the Franciscan Center. I won't do it as the justice that Angela would do. But I do want to introduce you to another organization, and I'll go through them pretty quickly, so that way we can then go ahead and move to our discussion and have an opportunity for asking questions, because there are some themes that have been emerging throughout for me already. So again, each of these organizations have been around for a long time, and the Franciscan Center has been around for more than 50 years. And they really have a wide continuum of various essential services that they're providing to the economically disadvantaged. And they have really been doing this work, making sure that they are providing care and services with dignity and a lot of caring and humanity. Oh, my slides are going fast. This might be on like an automatic thing, so I'm not pressing anything. So give me a second here. They do give out food. They have been doing this throughout COVID. They have in-person opportunities. They're giving out toiletries, but like every night and every day, they're putting different food together, bags that they give away, toiletries, etc. They are following the COVID-19 restrictions and requirements. So again, social distancing, asking all those questions about if you've been in contact with somebody that has been positive, if you've traveled, all that kind of stuff that I feel like many folks are used to at this point in time. I'm going to skip over the pre-COVID. What they usually have is their normal volunteer opportunities. But similar to what Jordan had expressed, there's always administrative assistance that is needed at the organization, or some of that work that can be done virtually. And because they are giving out food all of the time, they are having folks that come in and they're doing the night choppers and getting ready with the meals and having evening community dinners. And all this has been happening every single day. It's not stopped or slowed down once given COVID-19. They've been up and running the entire time. I am going to skip the video only because I don't know if I'm going to play it very well, but I do want to share just a couple of pictures that has been provided. Again, you can see these are in groups. So because of this, they've had to change their operations and spread things out. And they have, you know, a lot of folks have been working in the kitchens, et cetera. So you see on the top some people in masks. That's actually some of their staff as well that have been doing this work. And the other, they do a range of services, so it goes beyond food, many other activities that they do. One of the things that they do has been a real tremendous need here in Baltimore, and that is there are a lot of individuals that are living in Baltimore, particularly people that are returning from the criminal justice system, that when they are coming out actually realize that they don't have access to their identification, meaning that they don't have a state ID, driver's license, necessarily a place to live. And if you don't have that basic identification, people do come out with a prison ID card. That isn't going to be always something that's going to help folks to find a job, to find a place to live. And not just for that population of returning citizens, but also for people that just don't have access to that information. Maybe they've been homeless or in some sort of situation where they don't have access to those materials, and they can help and get their clients that type of information so that they can find jobs and housing and get back up on their feet. So they've been doing that for a long time, supporting identification. I went through that really quickly, and I know I had some like funkiness going on at the beginning there with the slides, but I did wanted to make sure that oh, thanks, I'm reading at once at the same time. I wanted to make sure that I at least shouted out the Franciscan Center. Again, they've been doing such incredible work for over 50 years. And all three of the organizations that you heard from today, Movable Feast, Project PLASE, and Franciscan Center, are definitely meeting very basic needs of people that are living in the greater Baltimore area. Movable Feast goes beyond that geographical area as well. So I do want to invite Angie and Jordan to kind of join back in here for a little bit of Q&A. I do want to ask one question first, and then I will ask all of those that are in attendance, if you have a question, feel free to drop it in the chat. And then from there, we'll take questions from our audience. But you all both had this opportunity to share a little bit more information about your organizations. You have both had Hopkins volunteers for a long period of time, and recognizing that things are different right now given COVID-19. But what is one thing that you might want our Hopkins students, faculty, and staff to know about your organization that maybe you didn't share when you were giving your quick presentations? What is one thing you want our Hopkins folks to know about your organization?
I think that I'll share one of my personal connections to Movable Feast, and it's something that I think is really important about not just our organization, but where we stand in the community and how we serve our clients. So I started off as a volunteer, and I came back as a volunteer for 2 years, because when I started volunteering here, I was just so struck by how dedicated the supporters are to this organization, and I had never quite seen that before. And it filled me with such a sense of community, and it was something that I had not experienced before. And with the supporters that are coming in to volunteer in the kitchen, to fundraise for us and do these special events and join our committees, nobody makes people do that. Like, people do that on their own free will. They do it because they want to, and they do it because they see like really how this organization is changing the lives of clients. And when I started working here, I saw that within our staff too. And a lot of people that work here, we've got people that have been here for over 10 years. Like, people really stick around because we are an incredibly transparent organization, and that's something that I value as a person in any organization. And everybody shows up every day to do the work that is required to do for the clients. And when we had to suspend our volunteer program, and the staff, we were working in the kitchen in place of volunteers, like, that really showed that was just even more true than I had known before, of just the lengths at which we'll go to make sure that our clients have meals. And when a volunteer enters our space to support that, it's just a really beautiful and wonderful experience. And I know that several students and faculty from Hopkins have gotten to be a part of that experience. And so it's just, I don't know, during a time when everything feels stressful and weird, hopefully this is something that'll make you feel nice.
I think that's really important that we understand that as well. Is like, what is the culture and the climate of the organization, and the way in which we treat our coworkers, the people that we're working to support. And so it's lovely to hear those personal stories of commitment and passion and humility in the way that we are working with folks. So thanks for sharing that, Angie. Jordan, what about you?
So I think before working here, I didn't realize that there is such a stigma surrounding the homeless community. And it's always just really amazing to me to see the clients and interact with the clients, because some of our clients are the most inspirational, amazing people I've ever met. And it's just really tremendous to see, like, especially like Angie said, when volunteers come in and they interact with our clients and they see, oh my goodness, everything I thought I knew about homelessness is not, maybe not accurate, and that there's so many different reasons people can be homeless. I mean, they're just so wonderful. And we're in the midst of a holiday gift drive right now, and I was going to the temporary housing facilities to get the wish list from our clients. And one of our clients, Heather, said to me, she said, I am much more fortunate than a lot of the other people in this facility. Take the coat or whatever you were going to give to me and give it to someone else, because they need it far more than me. And I'm just so appreciative of what you're doing. I don't need anything else. And it's honestly like really hard to get our clients to give us a wish list for the holidays, because they're just so grateful and humble and just wonderful that they're like, oh, well, I don't really need anything. You guys are already doing enough. So it's just, they're all wonderful people. And if you ever have the opportunity to speak with someone who is experiencing or has experienced homelessness, please do with an open mind, because everyone's story is different, and it's just tremendous the things you can learn if you kind of go into it without your preconceived notions and stigmas about the situation.
Great, thank you so much for sharing a little bit more about these personal stories. Are just so important for us to hear from one another. So one of the things that I've seen or heard echoed today across the organizations are the types of services that you're providing, the types of issues that we're seeing in our communities. And so it's everything from housing needs, food, people being in isolation and lonely, pre-COVID, during COVID, as well as both of your organizations, as well as Franciscan Center, have also worked with populations that are medically fragile, whether they have HIV, AIDS, or other chronic infections or diseases. And Angela, by the way, from the Franciscan Center, is able to join. Angela just popped on having issues with the camera, but Angela, you can certainly unmute yourself, and I'll give you opportunities to say hello. So these are just some themes that we've been talking about, and I think these are all important for us in the health professions to understand our populations and the issues that people are facing, and the work that we can do together. Angela, I do want to give you an opportunity to say hello. I breezed through your presentation slides just so I could introduce the Franciscan Center. So if you want to unmute yourself and say a hello, we would love to hear from you, if that works from you.
Good afternoon, everyone.
Hey, Angela.
Thank you for having me, Mindy, and hello, everyone else. Sorry we had a situation, so we've just been really busy, everyone, and I know as everyone else has been as well. There's such a great need for the disadvantaged and homeless population, and we're just trying to meet every need that we can. We have a tent now up, and we're going to start serving our daily meals outside. We are super excited about that. And we also want to give an opportunity for any nonprofit on the weekend who, if you all have an idea or an event and need that space, we are willing to share it with anyone who is in need of that space. So yeah, we're gearing up for a Thanksgiving meal on Wednesday, November the 25th. And we're also gearing up for a Christmas toy giveaway and a Christmas meal also. And we'll be doing all of that outside in our tent. So yeah, we got a lot going on and super excited about the holidays coming up. And so.
No, I mean, that's a great point. And Angela, I had shared with everybody that the Franciscan Center hasn't slowed down throughout COVID-19. I know you've been doing tremendous partnerships with other organizations and churches and groups all over. And as you heard Jordan and Angie, everybody else on the call, our nonprofit communities also work with one another. So this effort of like, how do we work together and support one another is a huge thing that we see in Baltimore and other communities. Angela, I do want to give you an opportunity to answer a question, and that is, both Angie and Jordan had already mentioned something about this. You know, I gave a very quick overview of the Franciscan Center and some of the services that you all provide. And you all have a long tradition of working with folks from across Hopkins as well, and volunteer roles and internships and all that kind of good stuff. What is it that you would want someone from Hopkins to know about the Franciscan Center? Whether it's a story you want to tell or just something else that you want to share to highlight the work that you do with our communities here at Johns Hopkins.
A good question. There's so much, I wouldn't know where to begin. But I really think the new atmosphere and vibe that's going on here is with our new chef and the energy he's bringing to the Franciscan Center with the meals, healthy meals, providing for the disadvantaged to keep their health good. And we're using farm to table food. Everything is coming in from donations, and he's using everything and just doing an excellent job with the meals and the excitement. He's sharing on Facebook. We have like dignity plates where we're showing how we're plating the meals, and we're just, we feel like we're changing the sense of humanity, where people sometimes think just give, you know, disadvantaged or homeless anything, but we want to give them, you know, the best, just like any other person should have the best. So I think that is what I would like to highlight about us now.
Awesome. Thanks so much, Angela. So we have a few minutes left on the call. I wanted to see if we have any questions from our audience. If so, feel free to go ahead and drop it in the chat. And we have Angela, Angie, and Jordan here all able to respond to the questions that you might have moving forward. One of the things that we could certainly talk about as we wait for other people to potentially chime up with their questions is the work that you all are doing is certainly having an impact on improving the health of those that are receiving your services. And I think that's important because we at Source are working with the health professional schools. So we're working to train future public health professionals, nurses, doctors, etc. So why would it be important for our Hopkins community to get to understand your organization, your services, and the way that this actually holistically supports the health and various outcomes of your service recipients?
So I can start with this one. One of the things that I learned really quickly as soon as I came on board with PLASE 2 years ago is that housing is a healthcare issue. So with a lot of our clients, we've noticed, and you can see with other organizations as well, the longer that you've been on the streets and the longer you've been experiencing homelessness, the higher risk you are for these common day-to-day illnesses that plague our population. So like Angie was mentioning, diabetes and heart conditions. If you don't have access to food and you don't have access to regular health care, then these are going to be like even higher risk of transmission. And not only that, but when you are on the streets, you don't have the ability to access services for chronic diseases like HIV/AIDS, or if you have MS. I mean, we have a client that has pretty severe heart disease. We have a client that needs to eat his meals from a blender. So it's just, when you have these experiences and you've had to live on the streets, then it really does impact your health in a negative way. And it's really important that then once they get housing, that they understand what they now can do to try to not only heal from that experience, but also to improve their health moving forward. I mean, we have health workshops every month and we have a nurse on site, but there's just so much that volunteers can get involved with to help our clients realize that, I mean, even like dental health, if you haven't been brushing your teeth, like what can we do now that you are stably housed and in that transition to make sure that you can be at the best kind of like state that you can be at even after having that experience.
I missed the very first part of your question because somebody knocked on my door, so I just want to make sure that I'm giving
No
you
worries,
the most
Angie.
correct answer.
We're just talking about the fact that, you know, that source works with the health professional schools, public health, nursing, and medicine. So why would it be important for our 3 schools to understand the work that y'all are doing to support the recipients of your services? How does that impact health? And why would that be important for these future nurses, doctors, public health professionals to understand your work?
Yeah, absolutely. So, you know, most of our clients, so this is a medically referred program. So our clients, most of them are coming to us through Medicare or Medicaid. So they do have access to some kind of insurance. But, you know, even with insurance, you know, like food insecurity and healthcare, like they have a direct effect on each other. And so like while a client might be in treatment for their illness, if they are experiencing food insecurity, there's a really good chance that they're not being compliant with their treatment program. You know, a lot of the medications that they might be on have a physical impact on them. If you don't have food to eat to take your medication with, you know, that's a really big problem for a lot of our clients. And so we have found that when they have regular access to food, they are more likely to stay in compliance with their medical treatment program. So then they are less likely to go to the emergency room. Like we see a decline in emergency room visits. They are taking their medication regularly. They are going to their doctor's appointments. You know, because they start to feel the benefits, like they feel the benefits of taking their medication, of being properly nutritioned, but also like we have our medical transportation program. So they have a way to get to their doctor's appointments now too. So there is a very, very direct effect on this. So it's not just healthcare maintenance, but at some point it turns into healthcare prevention as well. And so we actually are a part of something called the Food is Medicine Coalition, which is a national program. And it's all about doing advocacy work to get programs like ours recognized as medically necessary because of how it impacts insurance costs. I mean, like it's thousands of dollars per client a month that we see savings, you know, just by having access to food. And it's such a simple answer, but it's still such a hard resource for people to get. So I would say that's the greatest impact right there.
Thanks, Angie. Angela, what about you? Why would it be important for our public health, nursing, and medicine folks to understand the work that y'all are doing to impact the health of those that you're supporting at Franciscan Center?
Yeah, so a lot of our clients come from neighborhoods that are food deserts, and it's really hard to get healthy, nutritious food. So we provide that. We expose the disadvantage to a lot of different fruits and vegetables and things they've never even heard of or ever tried. So I feel it's good to support us, because if we can change an eating habit for people who are usually going to the corner store and eating candy and junk food and, you know, getting a lot of unnutritional items, if you support us, then we can change their eating habits, and then that ultimately helps them to be healthy and keeps them going. So supporting us with, you know, and any nonprofit trying to help those who are homeless and disadvantaged, it's a good thing to do. Giving back is always great to do.
Awesome. Well, I want to be mindful of the time. We don't have other questions that have come in the chat, but I also think that we've been pretty specific and detailed about the efforts underway with your organizations. I'll do one final reminder for those that are joining us live to take a look at the chat. If you are interested in connecting with Angie at Movable Feast, Jordan at Project PLASE, or Angela at the Franciscan Center, go ahead and drop in your information. We'll make sure that source connects you with our organizations. We do want to thank you all so much. Thank you, Angie, Jordan, and Angela, for joining us. We always love to hear from our partners and highlight your stories, highlight the wonderful work that you're doing with our communities, particularly here in Baltimore. So thank you for your continued work. Thanks for joining us, and thanks for giving us the opportunity to work alongside of you and support your efforts and partner. It's our honor and our privilege to do this work side by side, and we can't thank you enough. It's certainly a mutually beneficial partnership, and it just feels good to be with y'all.
Thank you so much.
Yeah, thank you so much for having us.
Yeah, thank you. It's always a pleasure working with you guys.
Awesome. Be well, everyone, and don't be shy about reaching out if you're interested in connecting, and stay tuned for future source partner panels. Be well, everyone.
Bye.
Bye-bye.